And now what you see is this insistence on about a monthly basis that a new and radically different variant has emerged. And this viruses mutate all the time, but this virus particularly mutates. And there are small mutations and medium-sized mutations, numbers, let's say, and also effect and larger scale mutations. Well, how about whenever it's convenient for the pharmaceutical companies? You think, well, that's cynical. Is it now? The biggest lawsuits in the history of the American judicial system have been levied against the largest pharmaceutical companies on a regular basis for the last 20 years. And since when has it been a proposition of the political left that pharmaceutical companies necessarily have our best interests in mind? Now, I'm not particularly cynical about pharmaceutical companies. I think they have a hard job, both in terms of research and development and marketing and sales. And they're going to do what they can to market and sell. But that doesn't mean that they are now to be the arbiters of all public policy, because our politicians are too cowardly and incompetent to do anything but devolve their responsibilities to so-called experts, domain experts. Politics is the art of analyzing the entire situation and charting a course forward. For politicians to trot out the experts and say, follow the science, just means that they've abdicated their own responsibilities. I mean, I'm not convinced that the evidence that masks work is scientifically credible. It's certainly at least doubtful. I read a paper the other day suggesting that to prevent the transmission of one case of COVID, you have to lock down 1,000 people. Like, how is that justifiable? Especially given that the mortality rate of COVID is actually quite low, unless you have a pre-existent health problem, particularly obesity, and although old age also qualifies, as it does for most diseases, but not all. And with regards to, let's say, the issue of child vaccination, it's like children have an unbelievably tiny chance of dying from COVID. I don't think there's any scientific justification for immunizing children under 12. Now, at least it's debatable, and I'm not a domain expert, although I'm a decent scientist and I know how to read the research material.